our discussion topic is celiac disease. And celiac disease, it is a autoimmune disease. It is a autoimmune disease. And which part of the intestinal part of the intestinal mucosa involved? The proximal small intestine. Proximal small intestine is involved. Intestine, duodenum and jejunum is involved. Okay, so it is autoimmune disease. The antibody formed against gluten diet. Antibody formed against gluten diet. Okay, and it is HLA associated disease, and HLA DQ2 and HLA DQ8. So this HLA celiac disease is HLA associated, and it is strongly associated with HLA DQ2 and HLA DQ8. Then clinical features. Patient is weak, fatigue, then patient have diarrhea, abdominal distension, then foul smelling of stool, and weight loss, because due to malabsorption, weight loss. So these symptoms are seen in the patient of celiac disease. And then diagnosis. So how can we diagnose this celiac disease? Through main biopsy. By biopsy we can diagnose it. In biopsy we have seen the villus atrophy, and crypt hyperplasia. So in biopsy we can see villus atrophy and crypt hyperplasia. In serology, it is very important in serology part of celiac disease. Anti-endomysial antibody positive, and it is most based specific plus sensitive. It is base sensitive and specific anti-endomysial antibody. Then anti-tissue transglutamase antibody. Anti-tissue transglutamase antibody. In serology but we can diagnose this disease by clinical features, biopsy and serology. And in celiac disease there are some association of disease. association of disease, some association of disease. So association number 1 is dermatitis herpetiformis. Herpetiformis, type 1 diabetes mellitus, and it is most common association. Type 1 diabetes, and number 3 IgA nephropathy. So these are the association of disease with celiac disease. Then treatment. Last part is treatment. Treatment is about gluten-free diet. Like patient should avoid wheat, barley, rye, etc. Okay, so gluten-free diet. And if refractory celiac disease, a patient is diagnosed with a refractory celiac disease, then we should give steroid. So this is about celiac disease. It is an autoimmune disease, and proximal intestinal mucosa mostly involved duodenum and jejunum. Okay, antibodies formed against gluten, and it is associated with HLA-DQ2 and HLA-DQ8. Clinical features: patient is weak, fatigue, diarrhea, abdominal distension, foul smelling, weight loss. Also patient have seen ascites. It is a diagnosis by biopsy, villus atrophy and crypt hyperplasia. In serology, anti-endomysial antibody is positive, and it is base specific and sensitive, and anti-tissue transglutaminase antibody also seen. Association of disease: dermatitis herpetiformis, type 1 diabetes, and IgA nephropathy. In treatment, gluten-free diet. Patient should avoid wheat, barley, rye, and in case of refractory celiac disease, steroids given.